Hi, my name is Avisha Patel, and I'm going to be talking to you about carcinomas. So basically, a carcinoma is a mix of arteries and veins that tend to bleed a lot. They're popcorn-like substances in your spinal cord or brain that lack elasticity. So because of the lack of elasticity, the blood flows in, then letting the blood flow out, which is very bad for the brain or spinal cord. Johns Hopkins Hospital estimates that less than 1% of people are born with carcinomas in their brain or spinal cord. The cause of it is hard to estimate because the lesions could be mixed with other vascular malformations. This occurs in the tissue of the brain or spinal cord or even the nerve roots of the spinal cord. Hemorrhaging occurs in small amounts, and they're separated between years or months. In the beginning, the bleed worsens and then it gradually improves because the blood then gets absorbed up. The decision of treatment is balanced with the number of years the patient is at risk. So for example, you would take the age of the patient and then the location of the carcinoma because the treatment does cause permanent deficits. Symptoms occur in both male and females, and they're between the ages of 20 to 40. There's a loss of movement and abnormal sensations such as tingling, tickling, or burning of a person's skin. There also could be a loss of feeling in the legs. The carcinoma takes up valuable space, which causes the nerves to compress, which is really bad for the spinal cord and brain. So depending on the location or the extent of the bleed, this could cause permanent damage. With a minor bleed, you could fully recover, but you'd still be at risk, so the doctors recommend that you get monitored every 6 months for an MRI. With a heavier bleed, you slowly recover, and after 12 months, whatever pain is still there is permanent damage. So you're probably wondering why I chose to talk about such a random topic. I chose it because my dad has a cavernous malformation in his spinal cord. His symptom was a hypersensitive skin. So he felt the tingling sensation in his abdominal area. In a small section of his back, he felt that ants started crawling slowly and it started to get worse. Later, along with the sensitive skin, pain had progressed deeper into his right abdominal area. It was painful enough for him to head to the ER. The doctor there had ordered an ultrasound, which is an image of the internal organs. They found out later that he had gallbladder stones. So towards the end of 2010, the surgeons took out the spinal cords, but the pain continued and we had no idea why. This is a picture of my dad's MRI, and this is the carcinoma, and the carcinoma is basically inside of the spinal cord. So they scheduled an MRI, and that's MRI, and we finally got the correct diagnosis. He had a cavernous malformation in his spinal cord. The chances of a bleed are usually 0.7% to 2% chances a year. However, he already bled 3 times during the year. The doctor gave him 2 bad options. One of the options was don't have the surgery, but risk further deficits, and at the worst being paralysis from the chest down, or 2, remove it and live with whatever damage is caused by the surgery. So he obviously chose to do the surgery because he didn't want to think about a time bomb in his body. So they successfully removed the surgery, but he does have permanent sensory loss causing numbness from the waist down. He's able to drive, but he finds it uncomfortable because his legs just go totally numb. He's able to drive, but he finds it uncomfortable. So for 4 years, we haven't had a family vacation since he can't sit for a period of a long time. But I hope that changes because if anyone deserves it, it's him. For the past few years, it's been rough, but every time I come home, I always see a smile on his face. He's the bravest man I know, and he will always be the one I look up to. He will always be my hero. Thank you.